Is there a COVID outbreak at the Olympics? At least 40 athletes have tested positive. At least 40 athletes, including Team USA track star Noah Lyles and swimmers from multiple countries, have tested positive for COVID-19. What safety protocols are at the Olympics? At least 40 athletes competing at the 2024 Paris Summer Olympics, including Team USA track star Noah Lyles and swimmers from multiple countries, have tested positive for COVID-19 in the last 2 weeks. The uptick in cases has raised questions around the measures in place to stop the spread of COVID at the Paris Olympics. This year's Games are considered the first post-pandemic Olympics. Unlike the postponed 2020 Summer Olympics in Tokyo and the 2022 Winter Olympics in Beijing, there are no strict protocols or restrictions around COVID-19 in Paris. However, COVID-19 is still spreading around the world. The United States is facing a summer wave, and the virus is also on the rise in Europe, including in the Olympic Village. Globally, the COVID-19 test positivity rate is about 10%, but it's 20% in Europe, Dr. Maria von Kerkhove, Director of Epidemic and Pandemic Preparedness and Prevention at the World Health Organization, told reporters at a UN press briefing on Tuesday. In recent months, regardless of the season, many countries have experienced surges of COVID-19, including at the Olympics, where at least 40 athletes have tested positive, said Van Kerkhove. Which Olympians have tested positive for COVID-19? The actual number of COVID-19 cases at the Paris Olympics remains unclear, as testing and reporting varies by team. However, a number of athletes have publicly announced that they tested positive during the Games. United States Team USA sprinter Noah Lyles is the latest athlete to confirm a diagnosis. Following the 200-meter final, sprinter Noah Lyles' mother confirmed to NBC News that he tested positive for COVID-19 on Tuesday, August 6, and opted to run anyway. Lyles secured the bronze medal for his performance, but collapsed on the track, gasping and clutching his chest following the race. He was then wheeled away to be assessed by medics, NBC News reported. In a post-race interview with NBC's Lewis Johnson, Lyles described his initial symptoms and how he came to test positive. "I woke up early about 5 a.m. on Tuesday morning, and I was just feeling really horrible. I knew it was more than just being sore from the 100, Lyles said. He woke up team doctors and took a test which confirmed he was positive. In a joint statement, the U.S. Olympic and Paralympic Committee and Team USA confirmed to Today.com that Lyles tested positive for COVID-19 on August 6. Our primary commitment is to ensure the safety of Team USA athletes while upholding their right to compete. After a thorough medical evaluation, Noah chose to compete tonight. We respect his decision and will continue to monitor his condition closely," a spokesperson says. Following Lyles' positive test, the U.S. POC and USATF swiftly enacted all necessary protocols to prioritize his health, the well-being of our team, and the safety of fellow competitors, the spokesperson adds. As an organization, we are rigorously adhering to CDC, USOPC, and IOC guidelines for respiratory illnesses to prevent the spread of illness among team members, the USATF says. Australian swimmer Zach Stubblety-Cook revealed he was dealing with COVID in an Instagram post shared shortly after he won the silver medal in the men's 200-meter breaststroke final last Wednesday. Stubblety-Cook finished a 5-day course of antivirals for COVID. Wednesday, the Australian Olympic Committee tells Today.com in an email. Lonnie Pallister, another swimmer for Australia, also tested positive for COVID-19. Relay swimmer Lonnie Pallister is currently completing the 5-day course of antivirals, the AOC says. The 22-year-old withdrew from the women's 1,500-meter freestyle event on July 31st to save her energy for the Ford Palmer 200-meter freestyle relay on Thursday, August 1, the AOC announced on X. Pallister competed in the highly anticipated relay, helping win gold for Australia. On Tuesday, the AOC said in a statement that 44 Australian athletes and officials had tested positive for some form of respiratory or gastrointestinal illness. A total of 85 people were tested. 31 of those who tested positive for an illness were athletes, and 16 of these athletes tested positive for COVID-19, the AOC said. Our testing has been the most extensive and accurate of any games, allowing early and targeted treatment, said Australian team doctor Dr. Carolyn Broderick. Some illnesses were detected on arrival, others during training or competition, and some after competition. With more than 1,000 Australians in team accommodation, these results are modest and in line with expectations, said Broderick.